Great. Well, thank you. And I had the opportunity to serve as health minister for almost 2 years, and I think the first thing I can tell you about healthcare is it is a challenge, but there's also big opportunities. And we have to have the courage to go after those opportunities. And this is where leadership does make a difference. And I'll give you a couple of examples. For one thing, we said we don't need 5 different purchasing organizations in each of the health authorities. We can actually bring them all together into one as joint procurement, make sure we drive better pricing. That's saving about $150 million a year. We went to the drug industry and we said, you know, British Columbia can't afford to have some of the highest prices for generic drugs in the country. We're going to negotiate a new deal, a deal with the pharmacies that recognizes we're not going to continue to pay the highest drug prices. We negotiated an agreement that when fully implemented in 2013 will save $380 million a year for British Columbians and for government. Those are the kind of opportunities we have in healthcare. Pay for performance, or patient-focused funding that I was so proud to implement. British Columbia is the first province in the country to do what is done in dozens of countries around the world, which is to say we need a better funding system than just a block funding system that says, here's your budget, please stay within it. We need to have a kind of funding system that will drive change in the system, productivity in the system. And there was all the usual suspects came out and said, you know, this is a terrible thing, how terrible it is. The only people that seem to really love it are patients, doctors, nurses, and the people that work in the system. So again, I think that there's opportunities in healthcare. We spend 46% of our budget on healthcare. If we just take the approach that we can't do anything different, it's a problem. But if you're willing to go after the opportunities of government spending 46% of your budget and look for those opportunities, I can tell you, you can find dollars and you can reinvest those dollars and you can help bend down the cost curve in healthcare, and that's what we need to do.